Hi, this is Dr. John Neustadt. I'm president and founder of Nutritional Biochemistry, MBI, and I'm excited to bring you another Facebook Live video. Last week, I talked about why MBI was initially started, and this week, I really want to talk to you about some of the frustrations I've had over the year, both as a consumer, a healthcare consumer, because let's face it, even as doctors, we all get sick at some point in time, but also as a healthcare provider, some of the frustrations that I've had. And so I want to help you avoid those in your own life so you can get the best possible healthcare for you and your family by sharing with you my 3 tips. These tips are short, they are succinct, and they can help you understand both how the medical system works a little bit and how you can ask better questions of your healthcare providers to make sure you're really understanding what they're recommending and that it is in your best interest and that you want to do it. So tip number 1, understand why the test is being run. We run blood tests and other types of tests, CTs, x-rays, examinations for a variety of reasons. Tests are run to diagnose a disease, to rule out a disease, to decide on the best possible treatment and to monitor treatment, and to make changes to treatments, to understand what treatment options are available. So ask the question of your doctor, will this test change the approach to treatment? That's a really crucial question to ask. And if they say no, then follow up with asking them, well, why are we running it? Because if it's not going to change how they approach what's going on with you and treating with you, is the test really necessary to spend the money, and who wants the pain of a blood stick on a blood draw? Tip number 2, your health is more than just a number on a test. This is a really important point because so often people talk to me about their test results, my bone density test results, my cholesterol, my fasting blood sugar. And so the question is, those tests have value and utility, and they're important, but the real ultimate question is, what does that have to do with the clinical endpoint that we're trying to prevent or work with somebody on? And by that I mean, with osteoporosis, for example, a bone density test is a number, or provides a number, a T-score. And that is the diagnostic criteria of osteoporosis, is getting a low T-score. Oftentimes, recommendations for treatments for osteoporosis really treat that number on the test to increase the T-score, to change the number on the test. But the question is the number on the test the most clinically relevant thing that we want to be cautious of? And the answer for many conditions is no. For osteoporosis, for example, the most dangerous aspect of the disease is not the bone density test results. It's, are you going to get a fracture? Are you going to fall and break a bone? Because if you have osteoporosis and you fracture a hip, you have up to about a 40% chance of dying within 12 months. And if you're one of the lucky ones to survive, you've got about a 20% chance that you're going to require long-term care with chronic pain, reduced range of motion, difficulties with activities of daily living. So the real issue with osteoporosis is preventing a fracture, not necessarily just moving a number on a test. So the question is, how predictive are the bone density tests for predicting your fracture risk or someone's fracture risk? The World Health Organization, the American College of Obstetricians and Gynecologists, myself, who's looked at the research, all correctly conclude that fracture risk depends on factors largely than bone density. In fact, going back decades, we now know that bone density test results only predict 44% of women who will get a fracture and only 21% of men. So while it is an important piece of information to have, it does have some predictive value, it's by no means the whole picture. So when you have a test result, ask the doctor, how predictive of this is it for me for fracture? How predictive is this this test itself for predicting fracture, or when it comes to cholesterol, how predictive is the test for predicting, am I going to get a heart attack? Because that is the biggest risk with elevated cholesterol, is actually getting a heart attack. Or for fasting blood sugar, or hemoglobin A1C, which is another measure of blood sugar in the blood. How predictive are these that I am going to end up with kidney failure or diabetic retinopathy? Understand and try and get the information to really figure out how well the test is actually predictive of what you are concerned about happening to you. And then, as an extension of that, ask the question of any treatments they recommend. How effective is it at reducing the risk for, again, whatever it is clinically or whatever it is with your health that you are trying to treat or prevent? So, for example, a lot of the osteoporosis medications, the most popular ones, bisphosphonate medications, Fosamax, Actonel, Didronel, those are often used with people with osteoporosis, and they will change a bone density test result. But the question is, well, that's great, but how effective are they at reducing my risk of fractures? And a review of research has shown that, frankly, they're not that great, that many of those medications don't actually reverse the risk of a first hip fracture, and that they also then have some side effects that may not be appropriate or may not be worth the risk. These are conversations to have with your healthcare provider to really understand if these medications are appropriate for you. And the other thing to understand is that there is a difference between preventing an event from happening the first time, never having had a fracture with osteoporosis before, never having a previous heart attack, and then having an event like that happening and understanding, are the medications helpful for what's called the secondary prevention, if you've already had the event, preventing it from happening again. And the answer is that many of these medications are much more effective at helping prevent a secondary occurrence than preventing an occurrence that's happened for the first time. So really try and relate any test and any treatment that's being recommended back to you, your body, your health, and ask the question, what is it that we're trying to prevent here? Maybe you don't know. Just ask the question, hey doc, what is it that we're actually trying to prevent? With bone density, well, we're not trying to prevent my bone density score from hurting me, because a bone density score doesn't hurt me. What are we actually trying to work on here? And then ask additional questions until you really fully understand, is that going to be the best option for you? Tip number 3, remember, you're the boss. Healthcare is a service industry. It's a service profession. When I was in clinical practice, I was there to serve my patients. I considered myself their employee. They could hire me, they could fire me. And so it's very important to understand that really at the end of the day, when you leave their office, they go home to their family, and you go home to your family, but you're always in your body. At the end of the day, you are the boss of your healthcare decisions. You're in charge of making sure that you have the information that you need to make the best decisions. And part of that really comes with education, continuing to learn yourself about your body and how it works, and improving the quality and the kinds of questions that you're able to ask your healthcare provider. And if you're not getting the best service, the service that you like, then you can Google it, you can find other resources, you can reach out to community forums, you can find other healthcare providers. There are a lot of resources out there to help you continue to learn how to ask better questions and to make sure you're getting the best possible healthcare that you can have for you and your family. So I want as many people as possible to have this information so that they can interact with their doctors and make sure they're getting the best possible healthcare. So I want you to share this video. Go share this video, and for every share, MBI is going to donate $1 to this nonprofit that we love. We've been supporting them for years. The Vitamin Angels Foundation, they provide much needed nutrition to needy kids around the world, and it's truly a pleasure and an honor to be able to support them. So help us support them so we can change the trajectory of people around the world, and share this so you can help change the trajectory of the health of the people who you know as well. And remember, excellent health starts with you. So at MBI, we want to be your partner in helping you achieve the best health possible and to live a more dynamic, vibrant life. So head on over to mbihealth.com and see all the things we have to offer for you, and make this an amazing day.